This bill is going to end up costing $800 billion to $1 trillion over 10 years. Who's going to pay for it? Is it going to be paid for out of the health insurance programs that middle-class people have now through a tax on that? Well, not if I have anything to say about that.
Hi, Senator Sanders. I'm wondering if with all the distractions going on in the House healthcare debate, if any actual reform is going to be accomplished with this bill.
Thank you very much for that excellent question. Here's where we are right now in terms of healthcare in the Congress. The House passed a 1,900-page bill, and if you're having problems getting to sleep at night, I suggest you read it. It is long, it is complicated, but there it is. The bill in the Senate should be on the floor fairly soon. The leader there is now melding together the bill that was in the Finance Committee and the bill that was in the Health Committee, and he will present that fairly shortly. Now, in terms of the House bill, I think this bill is not as good as many people think it is, not as bad perhaps as some people think it is. Bottom line is it takes us a major step forward in increasing coverage in America. We cover tens of millions of Americans who today have no health insurance. That's obviously a positive step. This bill also takes a giant step forward in terms of improving primary health care, getting doctors out into rural and urban areas where we do not have primary health care physicians, and that is a significant step forward. It does a good job in terms of disease prevention, focusing on why people are coming down with heart disease, cancer, diabetes, other chronic diseases, putting money into that, keeping people healthy rather than treating them after they are sick. The bill in the House makes some good progress in having the government negotiate drug prices on the Medicare Part D and filling that so-called donut hole, which is really hurting many senior citizens in this country. It also makes some important steps forward in terms of insurance reform, doing away with pre-existing conditions and not allowing insurance companies to dismiss people because they committed the crime of being sick in the previous year and running up a large bill. One of the very significant negatives in the House bill, as many of you know, is that an amendment passed which essentially will reduce access for millions of women to exercise their right of choice as to whether or not they want to have an abortion. And that, to me, is simply not acceptable. The other problems that we're seeing that we have got to deal with in the Senate bill is that, given the fact that, in my view, the real solution to this problem is a Medicare for all single-payer system, we're going to try to at least give states the option to go forward and move toward a single-payer system, whether it's Vermont, where we have a strong single-payer movement, California, Pennsylvania, other states. I think that if one state pulls that off, it'll spread around the country. So we're going to work at that. The other question is, people do not know that the so-called public option in the House bill only available to 5 or 6 million Americans, nowhere near enough. We want a strong public option that is available to as many Americans as possible, via my druthers, all Americans. Other issue we have to deal with is this bill is going to end up costing $800 billion to $1 trillion over 10 years. Who's going to pay for it? Is it going to be paid for out of the health insurance programs that middle-class people have now through a tax on that? Well, not if I have anything to say about that. So we want to fund healthcare reform in a progressive way. Also, at the end of the day, middle-class people are going to be saying, hey, is this affordable? You know, what happens if I spend 2 weeks in the hospital? Between out-of-pocket expenses and my premiums, what percentage of my income am I going to be paying in healthcare? In the House bill, you'd be surprised, you'd be paying a pretty high percentage of your income. So we've got to work on the issue of affordability as well. In the midst of all of this, you have tremendous pressure from the insurance companies, the drug companies, medical equipment suppliers, all of the guys who are making billions of dollars in healthcare today who really don't want anything substantive to take place. So we are right now in a very interesting moment, and I would hope that from the grassroots of America, people will tell Congress to do the right thing on this terribly important issue. Thank you very much.